Our next session is our PPI panel. So we're delighted to ask our PPI members to come to the stage here. And we're going to, we've had a decade of PPI involvement in Cancer Trials Ireland. And so we're very much looking forward to their insights about how we could be doing, how we could be doing things better, and what the challenges have been.
So I am switching hats to the other half of my role now, and I am the Patient Engagement Manager here at Cancer Trials Ireland. So I'm delighted to be joined by Niki Warner, who is the Research Programme Manager in the Irish Cancer, Research Partnership Programme Manager at the Irish Cancer Society, by Martin Sweeney, who many of you will know is the co-principal investigator for PROACT and a member of our Patient Consultants Committee. And lastly, I'm joined by Patrick Kivlehan, who is the chair of the Patient Consultants Committee at Cancer Trials Ireland. He is a board member of Cancer Trials Ireland, ensuring that the patient voice is integrated at the very top down. And I suppose they're going to give us a flavour of the evolution of patient involvement at Cancer Trials Ireland, building a little bit on the poster that Seamus mentioned earlier, which we will present at ASCO this year. So thank you all for joining me. I might start with Patrick, because he is one of the longest standing patient members of the PCC at Cancer Trials Ireland. And you might just share with us, Patrick, a little bit about your thoughts on the evolution of PPI at Cancer Trials Ireland and how that has evolved over time.
Yeah, certainly. Thanks, Emer. I'm glad you didn't say oldest member, but anyway. Yes, as Seamus mentioned, that it's our 10-year anniversary. The PCC was established in 2016 with 3 patient reps. In 2018, Seamus Cotter and myself joined a group to swell it to 5. And we sort of stayed at that level until 2020. COVID had a very negative impact on what we could do. And then in 22, CTI sort of made the decision to allocate funding to a PPI coordinator role, and that was a real game changer, because from that then the group started to grow and become involved in more projects. We've had 2 online recruitment processes which have been very successful, and currently our membership now stands at 33, which is very, very impressive. All DSSGs now have a patient rep, which was one of our key objectives, so very much going in the right direction. Along the way, some members have left to pursue other advocacy roles. Unfortunately, some members have passed away, so we remember them fondly. And I'd like to thank personally everybody past and present for all the contributions that they've made. It's really been excellent. Regarding then the kind of role, I suppose, is that it's broadened out. I would encourage anybody who's considering becoming involved in patient advocacy to either contact Emer, Martin, and myself after this, or contact CTI directly. It's a very fulfilling role. You can become involved at very much at different levels and at the level that you prefer. So people can be in the background if they want. They can review patient information leaflets, help with grant applications, or the egomaniacs like Martin and me, you can sit on stages and talk to people, or do your patient-led research. It's a very diverse role, and it must be very, very fulfilling. So we'd hope that we continue to go forward. The greatest thing a patient can bring to the whole trial process is your experience, and all those experiences are individual. So we need as many members as we can have, and newer members are always welcome. I think in the problem, I think, is that there aren't any formal pathways for patient advocacy. Patients have to find their own ways to how they get involved, and I think we're missing a bit of a trick. That is a lot of experience, a wealth of knowledge that patients have that they can bring to the clinical trial process. So I'd encourage anybody, if you can, become involved.
Thanks, Patrick. I might bring you in, Niki. Obviously, the Irish Cancer Society are a very strong partner of Cancer Trials Ireland, and the funding that the Irish Cancer Society provide allow us to develop this area of our work in patient engagement. But also, I suppose what's important is that there is a level of accountability between both organisations for good quality PPI, and I suppose we have, over time, developed a very strong working relationship from both charities in our combination in PPI, and I wonder if you might like to share something about that.
Yeah, I mean, thank you, and it's fantastic to be here today and to sit beside Martin and Patrick, who are real pillars in kind of patient advocacy and PPI, so it's a great honour to be on stage here today. And like you mentioned, and as Claire has mentioned and has been discussed today, we're really proud that we have extended our partnership with Cancer Trials Ireland for the next 3 years, so we will be providing 1 million a year. And I guess from the PPI point of view, I mean, we really share the same ethos when it comes to partnership and patient partnership in the society. So we fund a lot of research, and a lot of our ethos around that is that we make sure that patient partners have a direct say in the research that we fund. Martin here will have had experience as he sits on our PPI panel as well, and how we really bring the PPI contributors into our panels and make decisions on reviewing applications and sitting on interviews. And I think when it comes to good quality PPI, it is that accountability piece, and I think the best way to do that is to bring patient partners in at the decision-making stage, and not just bring them in to sit at the table, but to give them a meaningful chance to speak and to have their actual opinions and voices heard at that table. So it's not just, it's great to have people at the table sitting there, but also how are you going to encourage them to come and feel safe and feel comfortable to share their opinions, which may not be the same as your opinions, and that's okay. And like Patrick said so well, that it is about that lived experience, and we feel that very strongly in the Irish Cancer Society.
Thanks, Niki. It's great to have other minds to bounce off, I think, to make sure that we're doing a good job, and I think to hold each other accountable in that regard as well, just that we can have a conversation about it. I'm going to come to you, Martin, and you might talk to us a little bit about the developments in our patient-led research here at Cancer Trials Ireland, something that we're very proud of and something that has been a very successful journey. And maybe you'd share a little bit about that.
Thanks, Emer. Lovely to be here as well. And I think the great development that we've seen in the last decade or so is the impact that patient involvement in research has. And Siobhan Gaynor, who many of you will know, started the ball running really in Cancer Trials Ireland by, along with Seamus, leading a trial on the impact of metastatic breast cancer on patients, and how important that was outside of the oncological setting. And I think Seamus's presentation there 20 minutes ago, I thought was brilliant, because it spoke to how we're moving away now. Of course, the emphasis is on treating cancer, it will always be. But Seamus mentioned climate change and financial toxicity and transport costs. Those issues, if I might suggest, they come from patient involvement and participation in research, bringing the lived experience, the real impact of a cancer diagnosis to the table where researchers can consider those things. So I was really lucky after Siobhan carried out the metastatic breast cancer study to be asked to lead with Dr. Paul Kelly the PROACT study. And the importance of PROACT is that it's done now, we have the data, but we have somewhere to go with it. It was supported by Irish Cancer Society in terms of getting the best reach we could across the country to get people to participate, both patients and partners. But now what's happening with PROACT is that we're sitting down in the NCCP with the evidence from PROACT, and we're looking for change to take place. We're reviewing clinical guidelines now into prostate cancer, and the PROACT data is driving that. And there was a presentation 3 weeks ago on the INSPIRE trial, which Emer and many others was involved in. And I was able to relate how the PROACT data fed directly into a change in the protocol for INSPIRE, in that my experience or my learning from PROACT was able to inform the researchers as to how INSPIRE could be improved by introducing an additional patient initiated question. So, it's really important that we don't look at PPI as a box ticker or something that's tagged on to research. I think that eventually, and maybe sooner rather than later, patient participation in research needs to be embedded in the same way as ethics or other aspects of a research is, because we still have to be elected in. And it's not an absolute requirement of research to have patient involvement. And I think that's the next step. And I just want to pay tribute to Patrick, because as he said himself, he brought the PCC, the Patient Consultant Committee in Cancer Trials Ireland from, I thought it was 5, from 3 members to 33 in his tenure. And that's an incredible achievement. And now we're strong. We have presence in all of the DSSGs. We have input in effectively every research project that's presented to Cancer Trials Ireland. And that's the way forward. And the results are already evident that when you involve the patient, you get relevance. That's the first thing you get. You also get a sense of urgency if it's not there, because patients will always bring that as well, because just it's natural that we would. And it's as I always say, it's a win-win to have the patient at the table rather than just participating in the research, but actually involved.
Thanks, Martin. Niki, I might just draw you a little bit on that, on the importance of PPI. And I suppose Martin has alluded that the Irish Cancer Society were instrumental in sharing the PROACT study, and through a very targeted drive into rural media, we were able to ensure that we had representation in that study from across the country. But I suppose more and more, obviously the Irish Cancer Society are the trusted household name, and when Martin refers to the importance of PPI and hopefully its eventual mandated requirement, do you think that the Irish Cancer Society have a role there in reassuring people that PPI is something that is very valued and something to be encouraged and developed?
Yeah, absolutely. And it actually ties back to something Patrick and I were talking about earlier, and what Patrick alluded to with kind of those routes into PPI. I think we have fantastic PPI contributors in Ireland working across all different areas of cancer research. I think what we'd like to see is more understanding, I guess, in the community of what PPI is, and then representation that will follow behind that. And I think we have a role in the Irish Cancer Society to communicate what PPI is to the general population, to all cancer researchers. And I think from that we can kind of look at, we are very bought into PPI. We know CTI is very bought into PPI, but how can we get that message across to the general population so that they understand what role PPI plays, and then hopefully you get more people interested. And that's definitely something at the Irish Cancer Society we're very passionate about. I know, for example, you have your ASCO poster, and Claire Kilty, who's the head of research, will be heading to ASCO as well to talk about PPI, and we're hoping to be able to even publicise that from the point of view of public and patient involvement in cancer research is, relatively speaking, maybe novel internationally, but in Ireland, actually, I mean, if it's been 10 years at the PCC here, and we've had PPI built into the research team with the Irish Cancer Society for, it's quite a similar length of time, it's how can we roll that out across, we've got pockets of people doing great work, but how can we get that out into the community? And I think in the Irish Cancer Society, we're lucky that we have fantastic comms and advocacy teams who can support in that, and definitely looking to see how we can extend that beyond just those pockets, get us kind of working together and getting that message out there that actually researchers benefit, because research is more relevant if PPI contributors are involved. PPI contributors benefit, they get to have their say, and also the general population will benefit if research is more relevant. It's more kind of targeted to what the actual needs are of patients across the board.
Thanks very much, Niki. And I think, Patrick, you've seen a lot of change in PPI in your 10 years of being involved with, or in the period of 10 years being involved with Cancer Trials Ireland. And I suppose, what has been the biggest change for you? What has been the biggest change? And I suppose, what's your vision for the future? What's your thoughts on what might lie ahead?
I suppose and thank you for your nice comments, but the real driver behind the increase in recruitment was the fact that CTI put resources into a PPI coordinator. So Sarah had the first role, now Emer has it, and without Sarah and Emer's doing all the hard yards, we wouldn't be where we are. So I must acknowledge their contribution. And I think that's an important part in relation to PPI. It can't just evolve on its own. It's going to need to be resourced at some level. It needs support. It needs a structure or a framework to build. I think one of the other big things we did was that initially PPC membership was confined to people who had experience of clinical trials. And we expanded that to those people plus people with a lived cancer experience plus carers. So keeping a very broad definition of what a PPI contributor is, because they all have a story to tell. And it's, as I said, it's their lived experience is where the value is. And going forward, I hope we continue to grow. I said we've representatives from all the various cancer types. I hope we get some new younger members, because we're getting older, aren't we, Martin? No. But in particular, I mean, I reflect back. I started my trial in 2013. It ended in 2018. In those 8 years, an awful lot has happened with clinical trials. So we'd like to see people who have a newer, more lived experience of a clinical trial. We'd love to see much younger patients as well. Again, it's this piece about the age profile. Cancer isn't ageist, it affects everybody. So having that younger person voice would really be interesting, I think.
Thanks very much. And just the last point, Martin, you might weigh in. I suppose our population is ever changing. And as you mentioned, we're having people younger and younger being diagnosed with cancer. One of the big challenges in PPI is to maintain a representative voice for our community. And I suppose that is something that we still struggle with at Cancer Trials Ireland, although we are making big efforts to have representation across all areas of cancer and all diagnosis. But I suppose just maybe as a final closing point, some thoughts on the diversity and how we might bridge that gap together to encourage more voices at whatever level they're happy to engage in.
Yeah, it's a huge issue because the reality of it is that mostly PPIs, people who are involved in PPI, are of a particular age cohort, socioeconomic background, indeed mostly women. We need to branch out. We need to get a better representation of cancer patients. And there are so many people that are precluded from getting involved in this kind of involvement that Patrick and I and others have, simply because they just cannot find the time or the resources to dedicate themselves to Cancer Trials Ireland or similar research and other advocacy roles. And this is a huge issue. One of the reasons is the elephant in the room, that there needs to be some proper reimbursement or compensation or appreciation for people. We're not speaking for ourselves when we say this. We're speaking for the people who can't get involved because of those restrictions. And again, it speaks to the need to embed patient participation in the processes. And just finally, I would like to just echo what Patrick said. Cancer Trials Ireland go above and beyond in trying to meet that need and address those issues. But it needs something more again, I think, to make sure, because the relevance of having people who are really struggling because of a cancer diagnosis, and it might be a quality of life issue rather than a cancer issue, to have that at the table and to understand what that means, it means that then you can do something about it as a researcher or as a body. We don't have that representation, and we need it. It's essential.
Thanks very much, Martin. Lots of food for thought there. In the interest of time, I'll wrap it up, but I know we'll be available later if anyone has any questions. Thank you.